Welcome. I'm Mark Johnston, the Acting Assistant Secretary for the Office of Community Planning and Development, and I'm joined by Ann Oliva, the Director of the Office of Special Needs Assistance Programs. Today we'll be introducing some information to you around some new and innovative ways that HUD will be providing training and guidance around the new Continuum of Care, or CoC program.
Thanks, Mark. As we thought about how we want to disseminate important information about our new programs, we thought about what has worked in the past and what hasn't. Obviously, presenting new material in person is best, but we can't always do that. And in the past, we have mainly relied on printed materials and long webinars. We realize that sometimes our trainings have been dense or hard to follow. So we decided to get creative about how to get you the information you need to run your programs. With the Continuum of Care program, we are launching a new approach to disseminating information. Think of it as CoC 2.0. We recognize that there is a lot of information to learn, and so we want to make sure that it is presented in ways that will be easily digestible and not as dense as some of the training materials we've provided in the past. We'll have a variety of training modules, from user guides and PowerPoint presentations to short 2 to 3 minute videos that focus on a specific, commonly asked question. We're also looking at innovative ways to use available technology to disseminate information. In this era of smartphones, Twitter, and instant information, we want to connect with our stakeholders where they are in the way that they live. Mark will now walk us through some of the new online products. Mark?
Thanks, Ann. We realize that everybody uses a different style for learning. Some people learn by listening, others by watching, and some by doing. Given this, we've used a wide range of modalities to present information related to the CoC program. A full list of the available training opportunities is available online on the Homelessness Resource Exchange and the One CPD Resource Exchange. Some examples are podcasts that include an interview with HUD staff on a specific topic, such as the CoC Governance Charter. Short broadcasts, like this one, on more general topics, such as an overview of leasing or rental assistance. And interactive presentations using new software on more complex topics, such as coordinated assessment. We feel that combined, these products will highlight and provide information on the key priority areas for understanding and implementing the new CoC program. Our plan is to continue rolling out products such as these in the coming months. In addition to announcing the new approach to providing training, we wanted to also take this opportunity to talk to you about the strategic direction we're moving in as a department on the issue of homelessness. This technical assistance initiative is a part of that overall approach. There are two major drivers for our work at this time. The implementation of the HEARTH Act regulations is the major program driver, and the goals of the federal strategic plan are the primary policy driver. The launch of this new technical assistance initiative gives us an opportunity to spell out what we want and expect our grantees to do on multiple levels.
First, of course, is compliance. As regulators, it is our job to ensure that our grantees are spending these funds in accordance with the law and the regulations. This has traditionally been our biggest focus, and it is, of course, very important. However, in order to reach our policy goals, we will need to broaden this focus beyond compliance.
We also want you to focus on strategic planning. With the availability of funds for CoC planning, we have a new opportunity for strategic focus. The alignment of the ESG and CoC programs allows for these dedicated funding streams to complement each other. And the current funding situation makes it more important than ever for our grantees to make the best, most effective, and efficient use of our resources. Communities should take a step back and evaluate what works and what doesn't. Reevaluate their current programs, services, and operations, and incorporate new structure and direction around planning and consensus building. We also encourage strategic planning around the implementation of the new system-wide approaches to confronting homelessness and new local strategies for delivering the assistance. An example of strategic planning would be to take a close look at transitional housing programs in the CoC and to make sure they are being used for priority populations, such as homeless youth, domestic violence survivors, or families that need substance abuse treatment. I just recently met with the mayor, who has a significant number of people sleeping on city sidewalks. He was looking for resources to confront this crisis. I informed him there are no new resources. I then pulled up his city's housing inventory chart, and we saw the city had relatively few permanent supportive housing beds, which would be the ideal solution for those living on the streets, and an extraordinary number of transitional housing units. He is going to be meeting with his Continuum of Care partners to assess how effective those transitional housing projects are and look into potentially reallocating some of those projects into permanent supportive housing.
We also want you to focus on using your data. The communities that are furthest along in the effort to prevent and end homelessness are those that use their data to drive local decisions. Data should help determine what programs may need to be reallocated, where there are gaps in the current inventory of services and housing, and to align dedicated homeless resources with mainstream ones. We want you to look at performance at both the project level and the system level. And I think we all know that the federal strategic plan goals can't be reached unless we have a mechanism for placing people into the most appropriate placements that get them out of homelessness quickly. To that end, we are asking you to implement new models and approaches. The federal strategic plan lays out proven strategies for communities to use, and the HEARTH Act regulations makes those tools available to you. Implementation of strategies like coordinated assessment or interventions like rapid rehousing and housing first will be key to moving us collectively to the next level of homeless services. Again, to Continuum of Care 2.0.
Thank you for joining us today for this broadcast. With the new ESG, CoC, and rural housing regulations, we are launching a new approach to disseminating information. We believe the new online products will provide you information to understand and implement the new CoC program. Please refer to all the related training materials on the new CoC program that are provided on the One CPD Resource Exchange. In the event that you have a specific question, please contact your field office or submit a question to the Ask a Question section of www.onecpd.info. Thank you.